So we have completed the major structure of this femur bone, mainly concerned with their proximal extremity and the shaft. I think this is visible to you all, Gaurav.
Yes, sir.
Yes. So we have completed the structure of the femur of the ox, and for the description, as we defined in the first classes, femur is the most massive and the longest bone. You all know it is the longest bone, also known as the thigh bone, and situated obliquely downward and forward in directions. And proximally, it articulates with the acetabulum of the pelvic girdle and forms a joint that is known as hip joint. And distally, it articulates with the two bones, mainly tibia fibula. Along with tibia fibula, one is the largest sesamoid bone, that is the patella, and forms the joint that is known as a stifle joint. So that's all about the definition of the femur bone. What is femur bone? And for description, it contains a shaft and two extremity. We have already discussed in the previous classes. And out of these three structures, two extremities and shaft, proximal extremity and distal shaft has been completed. Only remaining is the distal extremity. So prior to going on details about the remaining topic, we have an idea in the short about the proximal extremity. We all know proximal extremity mainly contains the three structures. That is the head, below that neck, and this is the trochanter major. And these three structures, along with the trochanteric fossa, is considered as the part of the proximal extremity. So now we see it is composed of the head, neck, and trochanter major. So we all know head located on the medial side and articulated with the acetabulums. And inside, on about the middle of the head, there is a non-articular sulcus, and that is known as fovea capitis. This fovea capitis located medially, and which is for the attachment of a ligament that is known as round ligament, and with the help of hip bone of the acetabulum, it comes in contact to each other and forms a joint that is known as hip joint. So about the head, it is the it's a round structure located medial, and on the center having a capitis, non-articular sulcus that is known as fovea capitis, along with the round ligament, comes in contact with the head with the hip joint, forms a joint, hip bone forms a joint that is known as hip joint. Now trochanter major, we all know trochanter major is the massive part for the gluteus medialis muscles, and lateral face is convex. Below that on the base there is the two tubercle, which is for the gluteus medialis and deep gluteus. We have already discussed in the previous classes. Now shaft, we have already completed the structure of the shaft. Shaft contains four surfaces: anterior, medial, lateral, and the posterior. This is the important point of the view here. The anterior, medial, and the lateral surface of the femur is covered by a voluminous muscle that is known as quadriceps femoris muscle. And this quadriceps femoris muscle is made up by the four muscles. Vastus, out of four, three originate from the vastus, that is the vastus lateralis, vastus medialis, and vastus intermediates. And next is the rectus femoris. And posterior surface is for the attachment of the adductor muscles, and below that there is vessels for the running of important vessels. They are known as femoral vessels, and this is in the form of sharp linear structure. So we have completed this structure. You see, this is the shaft. From here to here is known as shaft, and this shaft is anterior, lateral, medial, is covered by structures, means a muscle that is known as quadriceps femoris muscle, and beside that posterior surface is covered by adductor muscles, and there is a vessels for the running of blood vessels. This vessels is known as femoral vessel. So we have completed this slide. Now trochanter minor and trochanteric ridge, trochanteric fossa, and trochanter. You see here, this structure is known as trochanter major, and this is known as trochanter minor. These trochanter major and trochanter minors connected to each other by a ridge that is known as trochanteric ridge. And medial to trochanteric ridge, there is a fossa. This fossa is called Gaurav.
Trochanteric fossa.
Right, we have already completed. So this is the trochanteric fossa, and this line from the trochanter minor to trochanter minor to trochanter major, this in the form of a linear ridge, that is known as trochanteric ridge. So these are the structure present on the set. So trochanter minor present on the upper third of the medial border, and this is for the quadratus, femoris, and iliacus muscles. So they are important, and here is the distinguished point. One muscle is the quadriceps femoris muscle, which is present on the set on anterior, medial, and lateral part. Another is the quadratus femoris muscle, is present on the trochanter minor part. Okay, trochanteric ridge extend from the trochanter major in oblique directions and reaches up to the trochanter minor. And medial to this, there is a fossa. This is known as trochanteric fossa. And this trochanteric ridge is for the gluteus medialis muscle, and trochanteric fossa is for the three muscles. This is the gemellus, obturator externus, and obturator internus muscles. We have already completed these all points in the previous classes. Now, set distal third of this set contains a structure that is known as medial supracondyle crest and lateral supracondyle crest. So what is medial supracondyle crest and what is the lateral? You see here, this is the anterior part is known as trochlea and caudal part is known as condyle of the femur on the distal extremity. So above this condyle, there is a fossa. This is known as supracondylar fossa. This supracondylar fossa on its lateral part having a crest that is known as lateral supracondylar crest. Behind or opposite to this is the medial condyle, and above this crest is known as medial supracondyle crest. So we are going to describe these two crests, and beside this fossa, this is known as supracondylar fossa. So there are three important structures below distal third of this shaft. These structures are supracondylar fossa, lateral supracondylar crest, and the medial supracondylar crest. So now you see in the distal third of the shaft. Distal third of the shaft, we have already medial supracondylar crest. This medial supracondylar crest is for the medial head of the sternum. Name indicate medial head of the sternum, and another build for the lateral head of the gastrocnemius, along with in between two crest, lateral supracondylar crest and medial supracondylar crest and lateral supracondylar crest, there is a fossa. This is known as supracondylar fossa, which is for the superficial flexor digital muscles for their origins, and mainly located in between supracondylar crest of the lateral and the medial side. So I think this is clear. And rest of this border of the trochanter minor, below that there is another muscles originates from this part. This is for the pectineus muscle. Now, today we will start. We have already completed the previous point on the static class, day before static classes. Now is the distal extremity. So distal extremity contains following the structure for the point of the view. You know, for the diagnosis or for the identification of the bone, trochlea is always located anterior and condyle is always located posteriorly, and head is always toward the medial part. Okay, so this is the trochlea. See, if anybody asked you, explain the structures present on the distal extremity of the femur, so you have to describe the structure point wise. These structures are: first is the trochlea located anteriorly. Below that condyle contains two parts. One on the lateral side is the lateral condyle, and another is the medial condyle. Third structure, in between two condyle, there is a groove that is known as intercondylar groove. So three structure: trochlea, condyle, intercondylar groove. Okay, so next structure is in between this medial condyle and this trochlea. This is a structure. This is known as extensor portion for the complex muscle. We will go later on the point wise. So first you have to identify the important structure. So for this today's point, study point of the view, distal extremity contains following structures. These are: first trochlea, next will condyle, third will intercondylar groove, fourth will extensor fossa. Beside the lateral aspect of the lateral condyle, there is a eminence that is known as lateral epicondyle. So fifth structure is lateral epicondyle, and like by that on towards the medial condyle, this structure is known as medial epicondyle. So there are five structures, important structures near this distal extremity. First is trochlea, condyle, intercondylar groove. Next, extensor fossa and epicondyle. These epicondyle are lateral epicondyle and medial epicondyle. So these are the structure present on the distal extremity of the femur. So now you come. Distal extremity is the large and comprises trochlea in front and two condyles behind. We have already discussed. Trochlea articulate with the patella because trochlea located on the front anterior part comes in contact with the patella and forms a joint. This joint is called sonum. Sonam, are you listening to me? Sonam?
Yes, sir. Yes, sir.
You have to open your video and reply my answer. You have attended my previous classes day before yesterday? The next classes?
Yes, sir.
So question is that trochlea comes in contact with the patella, forms a joint. This joint is called as.
Sir, याद नहीं है.
Next for the Bhavesh.
Sir, I am not well, sir. I am fevered, sir.
Are you listening to me?
Sir, I am fevered. I am not well, sir, at this time.
Nidhi Rani. Nidhi Rani.
Sir, femoropatellar articulation.
Exactly right. This and when the condyle comes in contact with the tibia fibula, this joint is called Nidhi.
Femoropatellar.
When the condyle of the femur comes in contact with the tibia fibula.
Yes, sir. Femorotubular articulation.
So total these two joints combinedly called as
Stifle joint.
Exactly right. So in the first slide, it shows the distal extremity is the large, comprising trochlea in front and condyle behind. Trochlea comes in contact with the patella and forms a joint that is in the femoropatellar articulations. And the medial ridge of the trochlea is more prominent as compared to the distal ridge. Okay. Next is condyle are separated to each other by a fossa that is known as, we have already seen in this previous picture, this is known as intercondylar fossa and articulate with the condyle of the tibia through the median of the interarticular cartilage that is known as menisci. So what is menisci? Menisci is a cartilaginous structure which located just above the head of tibia and comes below the fill in the blanks. कौन बताएगा?
Sir, condyle of femur.
Condyle of the femur, right? And forms a joint that is known as femorotibial fibular articulations. Okay, so what is menisci? Menisci is the it is a cartilaginous structure located between head condyle of the femur and head of the tibia. So medial condyle present at the eminence for the medial aspect for the medial ligament, and lateral condyle presents two depressions on it, the lateral aspect, upper one is for the lateral ligament of the stifle joint, and lower one is for the popliteal ligament. So we are discussing about these structures. This is the lateral condyle and the medial condyle. Okay, so this is the lateral condyle, this is the medial condyle. Below that there is a cartilaginous structures located. This is known as menisci, and this is for the lateral cartilage, and this is for the medial cartilage and medial ligament, which help in the formation of the stifle joint. Okay, so this is about this lateral and medial condyle. Now, between the lateral condyle and the lateral ridge of the trochlea, lateral condyle and lateral ridge of the trochlea, there is a fossa. This is known as extensor fossa. Okay. On the lateral side, in between the lateral condyle and lateral ridge of the trochlea, there is a fossa which is known as extensor fossa, and this is for the accommodation of the complex muscles. Okay. Now, intercondylar fossa lodges the spine of the tibia. Intercondylar fossa, because this was the third important structure. First was the trochlea, next condyle, and third is the intercondylar fossa. This is for the accommodation of the proximal end of tibia, that is the tibial spine. And the anterior part of is for the posterior crucial ligament. Anterior part means anterior part of the this intercondylar fossa, anteriorly having a structure for the attachment of a ligament that is known as crucial ligament. At the posterior part, close to the medial condyle, is a depression that for the coronary ligament, and the lateral menisci, and close to the lateral condyle, another is for the anterior crucial ligament. So इस स्लाइड के अंतर्गत यह बताया गया है कि हमने जो इस टिबिया के डिस्टल एक्सट्रीमिटी में 5 स्ट्रक्चर के बारे में पढ़ा। पहला ए था ट्रोकिलिया, नेक्स्ट था कॉन्डाइल, थर्ड था इंटरकॉन्डाइल फोसा, फोर्थ था in between this trochlea and behind that lateral condyle there is a fossa that is known as extensor fossa, and fifth will the just adjacent to the medial condyle on it externally epicondyle, that is the medial epicondyle, and opposite to this direction, that is the lateral epicondyle. So there are 5 important structures, and we have completed all structure out of 5. First is the trochlea. What is trochlea? Trochlea is the pulley-like structure which located anterior part of the femur distally and comes in contact with the patella, forms a joint that is known as femuropatellar articulation. So that's all about the patella. Sorry, trochlea. Next was the condyle. There are 2 condyle, lateral condyle and the epicondyle. These lateral condyle and the medial condyle is located behind and is for the attachment of muscles on its the lateral aspect and is for the medial aspect. Okay, and next is the intercondylar fossa, which is for the tibial spine, and now is for the on its lateral side, lateral condyle, and with the trochlea there is a fossa that is known as extensor fossa, that is for the complex muscles. Okay, so this is about the structures of the femur of ox. You see here. Next, for the comparison point of view, sheep and goat, this is the almost similar to that of the ox, but here distinguish is that a distinguished line separates the lateral and posterior surface, because in this ox, anterior, lateral, and medial surface, they have no any demarcation between these 3 surfaces, and these all are covered by a muscle that is known as gluteal muscle. But here there is a line between the lateral and posterior surface. Now, trochanter major is little higher than the head. It's a trochanter major. This is the head. This is the trochanter major. In this there is almost equals in position, but in case of the sheep and goat, this trochanter major is slightly higher than that of the head in case of the sheep and goat, and trochanteric ridge is slightly oblique. This trochanteric ridge in case of the sheep and goat is slightly oblique, means trochanter manage is located in this position, so this is slightly oblique. Now this is the femur of the horse. Now you see, this is the femur of the horse. One important point is the femur of horse. There is at the structure where trochanter minor is present, there is a prominent structures in the form of a voluminous part of the tubercle. This is known as third trochanter or trochanter tertius. It's present in case of the horse only. This is the important and distinguished point. Next point is that it is more massive on the longest bone of the body, we all know, and the posterior face bears the proximal third. There is a rough eminence for the biceps femoris muscle, and fovea capitis is deeper and nose. Here it presents fovea capitis, just here fovea capitis. This fovea capitis is deep and nose in comparison to that of the ox. Now trochanter manner is in the form of ridge. This trochanter manner, because here trochanter manner is in the form of ridge only, and adjacent to trochanter manner there is a prominent part that is known as third trochanter. So lateral border bears the trochanter tertius and also known as trochanter, third trochanter, and it is the proximal third of the superficial gluteal muscle. This trochanter is, that is the third trochanter, is for the superficial gluteal muscle. Supracondylar fossa and the lateral supracondylar crest is better developed, and trochanteric ridge is vertical and extend from proximal third of the great trochanter. This trochanteric ridge, you see here, in this case, this trochanteric ridge is slightly oblique in positions, but here you see this is vertical in position. There is vertical in position. Next point is that the trochanteric ridge is vertical in positions, and great trochanter is made up of the convexity of summit. This great trochanter is in the form of convexity of summit. So there are some important points related to the femur of the horse. First is that you see here, this is the long bone, massive bone. Another first point from head, fovea capitis is deep and nosed. Second point, this trochanter major extend vertical in position, and this trochanteric ridge is vertically located. Next point, just lateral to this on the near the trochanter minor, this trochanter minor is not well developed. Near the trochanter minor, laterally having a well developed structure that is known as third trochanter or trochanter tertius, which is for the attachment of the superficial gluteal muscles. Okay. Next point is that this one, this is the supracondylar fossa. This supracondylar fossa is well developed in comparison. This supracondylar fossa is well developed in comparison to the other species. So you see here, this is the trochanteric ridge, this is the vertical trochanteric fossa, third trochanter, and this is the supracondylar fossa. This is the lateral supracondylar crest, medial supracondylar crest, medial condyle, lateral condyle. This is the condyle, lateral condyle, medial condyle, lateral epicondyle, lateral medial epicondyle, and intercondylar fossa. Now, in case of the pig, this is wide and relatively massive, and the ridge extend from the trochanter major to the lateral supracondylar crest is no well developed, and no supracondylar fossa. These structures are absent in case of the pig. This is the characteristic feature of the femur of the pig. Now, dog. In case of the dog, shaft is proportionally larger and strong, covered with the convexity and located forward in positions. And next point is that supracondylar fossa is absent. You see here, supracondylar fossa is absent in case of the dog. One important point, this is the condyle, lateral condyle and medial condyle. In between two, proximally, there is two important bones in the form of round structure. This is known as fibula bone. This is known as fibula bone. This is only present in case of the dog. And this trochanteric fossa is well developed. You see here, this trochanteric fossa is well developed, and head is also prominent, and on the center, fovea capitis is also developed. And this is on the trochanter major, but trochanter major as in comparison to head, not well developed, means it is less developed. You see here point wise. Supracondylar fossa is absent. We have already seen in this picture. Supracondylar fossa is absent. Next is that trochanteric fossa is rounded and deep. You see this trochanteric fossa is well developed, rounded and deep. Next point is that ridge of the trochlea is slightly oblique. You see, this is the ridge of trochlea is slightly oblique, but in this case is more oblique. This trochlea is more oblique. This trochlea is more oblique in case of the horse and the ox, but here is less oblique. Next point is that intercondylar fossa is wide. You see this intercondylar fossa in comparison to the other animals, it is wide here. Okay. So, in case of dog, another point is that we have already discussed on the posterior aspect of the distal extremity, immediately above the condyle, there is a small facet that is the sesamoid bone that is known as fibula bone. These fibula bones are 2 in number, rounded in shape, located on each side of the condyle of the femur on its posterior aspect. That means above the condyle. This is the important questions for the objective point of view as well as for the descriptive point of view. This fibula bones is present only in case of the dog and located posteriorly in positions just above the condyle, and they are developed in the tenderness of the origin of gastrocnemius muscles, which is this fibula bones is for the gastrocnemius muscles. Now last is that in case of the fall bird, head is prominent but smaller than that of the acetabulum, and articular surface stands on the trochanter and articulate with the acetabulum and in the form of facet of its limb. Lateral condyle present on the lateral aspect, a groove for the fibula bone for their heads. So you see this picture, this is the femur of the bird. First point is that this great trochanter, a trochanter major located just above to the head. First point, head is rounded but is in the positions not like the other species. It is just forms about the 90-degree of from their shaft. This is the shaft and this is the head. So it attaches with the acetabulum and in the position of the 90-degree. Now this condyle, this is the lateral condyle, this is the medial condyle. In between two condyle, distal condyle, this fossa is deeper and located from distal 2/3 up to the last position. So this is the distinguished point related to the femur of the fall. Okay. So here in this picture, there is some assignment is for you. You have to write on self regarding what is this structure, what is this, what is this. This is all a structure of the femur from the different aspect. This is the caudal aspect, this is the anterior aspect, and this is the both lateral and medial, and last this is the head, and this is the distal extremity or distal part. So I think I have completed the all distinguished point. If any query, you welcome. Sahil Raj Dwivedi.
Yes, sir.
What is this, Sahil? You see my cursor?
No, sir, I am unable to see this.
Gulshan, are you seeing? This cursor is visible, Gulshan?
Yes, sir.
What is this?
Sir, सर ट्रोकिलिया क्या है सर?
कुमारी आराध्या क्या है ये? What is this? कौन बोलेगा?
Intercondylar
फोसा बोल करके
Intercondylar fossa.
Exactly right. Now this is for the Ballab Kumar. Next question is for the Ballab Kumar. You have to unmute yourself. कोई भी अपने जब इसका नाम लेंगे वही unmute करेगा, बाकी सब mute करेगा. बल्लभ अरे बल्लभ unmute करेगा अपने आप को.
Yes, sir.
Vaibhav, sorry, not Ballabh, sorry. Vaibhav, what is this Vaibhav?
Yes, sir.
ये दिख रहा है वैभव?
Phobia. Yes, sir. Phobia capitis.
फोबिया कैप्टिस में कौन सा लिगामेंट लगेगा?
Round ligament.
कहाँ जाके जुटेगा?
सर वो जुटेगा सर ऊपर, यानी आपका हिप जॉइंट बनाएगा सर, हिप बोन.
किससे जुटेगा?
सर कॉन्डिलाई ये सर जुड़ेगा सर कॉन्टैक्ट विद एसिटाबुलम से सर.
एसिटाबुलम से, एग्जैक्टली राइट. चलिए नेक्स्ट क्वेश्चन इज फॉर प्रिया राज अनम्यूट करेगी.
Yes, sir.
You tell me 3 points, distinguished point related to the structures of femur of horse.
सर पहले तो थर्ड ट्रोकेंटर प्रेजेंट होता है
right?
और ट्रोकेंट्रिक रिज स्ट्रेट होता है, मतलब ऑब्लिक, मतलब स्ट्रेट।
Next,
और फोबिया कैपिटस राउंडेड और नॉच्ड होता है।
good. Next question is for Aman Kumar. Aman ji,
Yes, sir.
extensor fossa कहाँ मिलता है अमन? Where extensor fossa are present?
Extensor fossa, sir, lateral condyle and lateral crest के बीच.
क्या भानु प्रकाश सही बोल रहा है, गलत बोल रहा है अमन?
Yes.
क्या सही बोल रहा है? फिर से बोलेगा।
Yes, lateral condyle and lateral crest.
Lateral condyle and lateral
Ridges.
किसका
Yes. क्या sir?
किसका ridges?
Lateral condyle ridges, sir.
मिली
condyle का ridge नहीं होगा sir.
condyle रहेगा, ट्रोकेलिया रहेगा? Trochlea. Now question is for Anita. Anita, unmute.
Yes, sir.
Question is same. This extensor fossa is for the accommodation of which muscles?
सर नहीं पता।
That नहीं पता, कौन बताएगा? देव पवार.
Extensor muscle.
Extensor muscles, right?
एक्सटेंसर मसल सर।
हाँ. Now question is for Amit Ranjan. Amit Ranjan, are you ready?
Yes, sir. Yes, sir.
Good. अमित रंजन, ये हमारा जो कर्सर जो है, ये क्या है अमित रंजन? नंबर 4,
Third trochanter.
राइट. ये क्या है अमित रंजन?
I think trochanter is some greater trochanter.
ये क्या है? Now question is for roll number 271. 271. Roll number 271.
Yes, sir.
What is this?
Supracondylar crest.
This point where cursor is located.
I don't know.
You don't know? What does it mean? Amit Ranjan?
Supracondylar.
Yes, ma'am.
What is this? Yes, ma'am. Nahi, yes, sir.
Supracondylar fossa.
This supracondylar fossa is for the which muscles? Is any
Muscle.
muscles
Pata
located? Now question is for Gaurav Mishra.
Yes, sir.
Posterior surface of the femur in case of the ox comes in contact with muscles. These muscles are yes,
Quadriceps femoris.
quadriceps femoris. Is it
Quadriceps femoris.
My question is that posterior surface of the femur, this is the B is the anterior surface and this is the posterior surface. Posterior surface of femur comes in contact with muscles. These muscles. क्या नाम? अभिषेक कुमार बताओ उस मसल्स का नाम. कौन बोलेगा? मसल्स का नाम कौन बताएगा?
Vastus lateralis vastus.
Adductor muscle.
Adductor muscles होगा. Now question is for Basisht Kumar. Basisht ji, are you ready?
Yes, sir.
Anterior, lateral and medial surface of the femur in case of the ox is covered by a muscles. This muscle is
सर नहीं पता,
नहीं पता है, क्लास नहीं किया था।
नहीं सर नहीं क्लास।
बताओ अर्चना, तुम बताओ। एंटेरियर